Well, good afternoon. Thank you all for joining us. We're joined today by Nikki Ferris, the Executive Director of Infant Crisis Services. Tell us a little bit about what Infant Crisis Services does.
Okay, we are an emergency food pantry for babies and toddlers from the time that they're born until they turn 4. We are 36 years old ourselves, the organization is, so we've been doing this for the last 36 years, and our mission is really simple, and we've kept the same mission for all 36 years. We want no baby to go hungry. Now, those things have changed a little bit over the years, and definitely from COVID, we've made some changes, but this last January, we decided that we were going to begin helping families on an annual basis. For the other 35 years of our existence, we helped people 5 times over the baby's lifetime. And the baby's lifetime to us was from the time they were born until they turned 4. So families used 1 or 2 visits a year, but now our families get 4 visits a year, which is a significant increase. I think a 300% increase in the product that they would receive. So they could possibly receive 20 visits instead of 5 if they came from the time they were born until they turned 4.
Okay. So how has your organization's outreach efforts changed due to the pandemic?
Well, it began it's different, very different than the way that we usually serve. So I would say from the day that we pivoted immediately. We didn't really kind of wait to try to react to see what other people were doing. We said, we're going to do drive-through because that's going to be the safest for everybody. We're going to let them call in. We'll take their order over the phone. They'll come we have a covered area that they can drive through, and we will give them their items on the table so that we don't, but both parties, both the people that we help and our staff are safe. We also put racks out there with different things that they can take just because they're there, and they can help themselves to as much as they want. And sometimes it's extra bread, sometimes it's clothing, sometimes it's toys. So we're really trying to give the full visit that they would receive if they walked in the door. The one thing lacking is hugs and you're doing good. And we're anxious to get back to the days where we can tell those families, we see what a good job you're doing, and we appreciate that you're trying to help your baby.
Okay. So have you experienced an increased number of calls for assistance from people due to COVID?
Absolutely. I would say the first wave of people, very curiously, was people who couldn't get the product because the product was not at the grocery store. So I don't know if you remember at the beginning of this that you couldn't get diapers, you couldn't get formula, you couldn't get the wipe. The wipes were the big thing that I think people just went in and began hoarding them. And for many of our clients, that's all they can get because they have vouchers from WIC that allow them to go get certain kinds of things. So that first wave was people maybe more like you and me, honestly, that just couldn't get the product. The second wave of people was people who just recently lost their jobs. So those 2 waves were different than what we normally see. And they were out of a job suddenly, and they didn't even expect that they would need to have help from anybody. And then I'd say more recently, I would say it's mostly people who are on government assistance but just don't have enough to make it stretch, particularly with extra kids at home for such a long time, that we're getting meals at school and that may or may not be able to access the meals that are being provided through other organizations.
Okay. So what are some ways that people with infants can get help from you guys?
It's very easy. They call. They make an appointment and they give us their order, and we allow them to drive through and get it. We do have a limit of how often they can do it, but like I said, the limits are not as stringent as they have been in years past.
Okay. What are some documents that people need to provide to y'all when they come to pick up supplies?
Right now, just need to know a little bit about them and a little bit about their baby. Now, in times past, when people were coming here, we still don't require any ID or anything like that, but we'd like to see the baby. But we aren't even really requiring that they put the baby in the car and bring the baby to us, because we don't really know what the circumstances are because of COVID that make it even harder to get here now.
And so the best way for people to get in contact with you guys is just by calling you, right?
Absolutely. Our phone number is 405-528-3663. Be patient, because we're seeing a lot of people. So if you're on hold for a while, we will get to you. We don't like that either, but there are lots of people making calls and making appointments, and it takes a little bit extra time, because what we would normally do is interview the client internally when they came to the organization. Now we're basically interviewing the client on the phone. So be patient. We will get to you.
And what else would you like people to know about your organization?
We are, we've really remained true to our mission, even throughout this whole COVID pandemic. We really never didn't stay open. We really kind of feel like we were made for a time like this. We have been an emergency food pantry all of our entire existence, but we really were made for a time like this. So I'm glad that the community has been so supportive. When you think that people might, back off or be worried about themselves or all of that, that really hasn't been the case. And we hope it stays that way, because the babies keep coming in the door. Actually, they're not coming in the door. They drive through and get their items, but the babies are continuing to come to us. Another thing that we haven't talked about, but we have 2 baby mobiles, Thelma and Louise. They go to different sites other than our main site. So they go to, I believe we're in 19 different counties now. And we had to put them on pause, which we didn't like that, but we really couldn't figure out how to social distance on the baby mobile, because it's basically a short bus. But we figured out how to do that. So as of May 13th, they're back on the road. They are going, there's just really one back on the road now, but it's going out 4 times a week. So it will go to 19 different locations outside of Oklahoma County, and a few Oklahoma County locations now. One of them that we went to, I believe it was Lawton that we went to, and that day in a 4-hour period, we saw 175 babies. So our typical on the baby mobile is more like 25 to 30. So you can see that rural Oklahoma is really in need of the services, as is Oklahoma County, but there's so many more options here for them to, they can go to other food pantries, but when you go to rural counties, the rural places are much, much more strapped. So when we go out on the baby mobiles, we see lots of babies. So that, I think we looked at our numbers. We're at about 11,000 babies since the beginning of the year. And we think we'll probably see double that, if not more, by year end.